Maybe we'll dive directly into the topic. Jannine and Omar, maybe you can tell the audience a little bit about your company.
I'd love to.
Yeah.
First of all, thank you so much for inviting me. We are thrilled to see this topic of perimenopause and menopause on the main stage. This is a fairly new development as we think about the arc of digital health. So by way of background, I have spent most of my career in digital health, plus tech, Google in the early days before Facebook existed, plus a stint in the Obama administration. And within digital health, prior to founding Elektra, I was at Cityblock Health, which some of you may know of, was the 10th employee, had the opportunity to build and scale a business really focused on complex patients with both medical and social needs. But part of the reason I moved on from Cityblock was just they were not focused on women's health, and there is so much opportunity in that space. Not only in fertility, family building, maternal health, which is very important, and I'm glad to see that well represented here, but the fact that women outlive their ovaries by 40, 50 years. We're outliving men, but not necessarily in good health, and that is the focus of Elektra. So we are a digital platform. We provide education, counseling, and evidence-based clinical care to women navigating this 10-year journey. And we do that both direct to consumer, but increasingly working with health plans and employers. It's a stigmatized topic. So my ask to everybody in this room, we're all affected by this. We know women navigating this time of life. So talk about it, break that stigma, think about how your organizations might be involved in modernizing women's health in this way.
And I'm Omar Manejwala. I'm a psychiatrist, the Chief Medical Officer for Dario Health. And I'll introduce myself and Dario, but on the condition that you return the favor and introduce yourself to us as well. So so Dario Health exists for one reason, which is to drive sustained behavior change in chronic disease. And I think we've seen some challenges when it comes to point solutions. We've seen difficulty with patients, with people navigating multiple solutions. This is one of the big challenges with digital health. How do we solve for engagement? How do we solve for the complexity of this? So we deploy integrated solutions for diabetes and prediabetes, hypertension, behavioral health, MSK, conditions that overlap and are a significant pain point. Interestingly, just like you, we began in the direct-to-consumer space, which is just one of the best ways to gather real insights and data about what people actually want to use. So you can have a product that looks less like a health plan portal and more like, Uber Eats or Instacart or something you'd actually want to use, and then using those to drive expansion in the B2B2C. We've got a 250,000 users on platform. We have a big strategic partnership with Sanofi. We've got partnerships with Amwell and CVS and others. So it's really about making this pivot from direct-to-consumer to B2B2C so that we can help more people. Yeah, that's Dario.
That's great. So I return the favor. So Laurent van Leberghe, I'm investor in digital health actually since January, after 25 years in big pharma. Did BCG actually, then 10 years in Abbott around the globe as operations manager, managing country, managing a region when I was in Asia, based in Singapore, managing Russia, India, China, and then Southeast Asia. And then I spent time also in Chicago. And then Sanofi, 8 years, came back to Paris 2014. And last 3 years and a half, I was Chief Strategy Officer for the company. And then mid last year, I was reflecting with Paul Hudson, my boss, on what's next. And I figured that it was time for me to move on. And instead of going into a biotech, I said, where can I add most value? Investor as digital health is, let's say, an obvious topic, especially in Europe. We are lacking some investors with a healthcare background. We have a lot of tech background, we have a lot of finance background, but then I thought, wow, maybe I can make a difference there, especially as I lived a bit across Europe. So stay tuned. What I'm doing already now is as business angel, investing in a few companies, some in women's health, IVF, we're just talking about it. I like also technology that changed the way we do actually healthcare, invested in a VR company managing pain for acute pain at the hospital. Also in one focusing on quality aging. So the whole period before you have to go to nursing homes, because all of us very soon, 10, 15, 20 years, we will have to, get supported before going to a nursing home. And then one more in AI discovery in, genomic medicine. So very interested. And then obviously some other projects that are for the moment in stealth mode. But then I jump into questions that I'm sure you're interested in as we talk about personalization. And Jannine, tell us what you see as personalization and what you think is now possible, maybe that was not possible before.
Yeah, absolutely. I think that part of the promise of digital health is that we can personalize solutions to patients at the time that they are looking for it, at their fingertips. So in our case, these are often perimenopausal and menopausal women who are up in the middle of the night looking for solutions because they oftentimes have had a subpar experience with their provider. And I want to be clear that I absolutely support the work of our providers. They are stretched and overburdened. I'm the daughter of two physicians. I'm married to a physician. I have seen this up front, but many patients come to us time and again with, I didn't get any type of answer around my menopausal symptoms. It's sort of a shrug. I turned to Dr. Google. It's, having worked at Google, I also respect that company deeply, a terrible place to go if you are looking up one of the 30 symptoms of menopause. And so how do we deliver personalized information that is specific to the stage and phase that people are looking for, that is evidence-based, vetted, and high quality at their fingertips? And so I think this is really the promise of digital health, to be able to then move with people along that journey. And what we do at Elektra is so much of the patient education and counseling prior to connecting with a clinician, because oftentimes meeting with a clinician and receiving a prescription is 2/3 into the journey. And so personalization to me is really about delivering right time, right place, right education, and cutting through so much of the misinformation that is out there that particularly plagues our space, which I'm happy to talk more about, sort of hormone therapy and the controversies around it. But I think we do see it particularly acutely because there's so much confusion, and yet this is such a universal female experience. So that is part of the promise, and what I'm most excited about as we have more and more data to be able to analyze and think about predictive opportunities as well.
And you think about the opposite of that, like what's the opposite of personalization? I mean, and so I think about first generation digital health, which was really about deploying a user journey, and then second generation where you may be personalizing in some ways, maybe a few sizes fit all, maybe you're adjusting the nudge or the time of day, but what we really need now in digital is dynamic personalization of user journeys so that my history, how I'm engaging in this solution, and how others like me have engaged it can inform what I'm going to do next. Because engagement is the primary problem. If people sign up for these kinds of solutions, health plans, employers, and then nobody uses them. So if we can't solve that, and from our side, the way we're taking a look at that is by dynamically personalizing the user journeys for timing, for tone of messaging, the channel that you receive, the content that you get, the frequency of that messaging, which sometimes needs to go up and sometimes needs to go down, or else they're going to delete your app. And then even the recommended intervention. So I think about with women's health, with other chronic conditions, across the board, if we're not building the engines to dynamically personalize these experiences, people are not going to engage, they're going to delete the apps, and then we lose the opportunity for scaled solution of healthcare that's really the promise of digital health.
I couldn't agree with you more. I think, first of all, the head is connected to the body. And so we would say, well, for your behavioral health, you're going to go over here. And for your menopause health, you're going to be here. And for your, GYN care, you're going to go over there. We need to be able to leverage these tools to bring them together. We're not going to have one-stop shops, but we need to be able to do better, more seamless navigation. And I think to your point, we don't want engagement to mean that people are using your platform all day, every day. Like, that is not the goal. The goal is that you are there when folks need the solutions that they're looking for, perhaps beforehand.
Yeah, and that's actually what is really striking is that it's not so much talking about platform or talking about provider and then pushing it. I think the discussion you hear and what we're discussing before is actually what the patient needs. And if you put the patient in the center and you say, what do we provide to the patients that then they will use when they need it, how they need it. The second thing that is very striking, and you see it in Dario and Elektra, is that it's also tailored as it goes. Maybe you can expand a little bit on this one.
Sure. So we have, part of our platform has very strong engagement. We hire nurses and doulas who are expert in perimenopause and menopause, and it often touches on so much of these other chronic health conditions, which is part of why I love sitting up here with Dario, because they really have created this beautiful opportunity to take care of people across multiple dimensions more seamlessly. And so as we learn more about members, they're going through an intake, they're connecting with an individual. We do think it is important for some of that personalization to mean human interaction. And people want to engage differently. So for some, it's, I'm going to chat you every so often. For others, it's, I'm going to be part of the peer support community, and that's how I'm going to engage. But we are learning from that journey over time and being able to also do visit preparedness. So when the opportunity to meet with a clinician comes up, you get a personalized approach to, here's how you might advocate for yourself in this conversation, knowing that, say you're a 45-year-old woman, there's new guidance around mammograms, here's how we can address that. You are perhaps divorced and sexually active again. By the way, that topic never comes up in the visit with a provider, so here's how we can help you have that conversation to make sure that your needs and preferences are being taken care of, as opposed to just the quality checklist from like a HEDIS perspective. So we're able to bridge those gaps, bringing in both preferences, desires, as well as what is age-related and menopause-specific along the way.
Well, it wouldn't be complete if we didn't talk about partnerships, since that's the other portion of the discussion. So Laurent, can you share with us your perspectives on the value of partnership when it comes to digital?
Yeah, look, I put back a little bit of my hat from my last 25 years. Look, long time gone, the time when players thought they could do everything alone, even big players. It's a little bit obvious for startups, but big players obviously need an ecosystem around. That's super clear. The value of partnership, maybe I can expand a few topics. I mean, first is for big players, big pharma, it's speed, and it's learning a world they don't know. Putting money, putting resource, big pharma can do, but we have no time to wait 5-7 years. The patient needs the service, and pharma are a little bit slow in getting it in place. So you will see most of them going after startups, making partnership like Sanofi with Dario, or like Sanofi did with Okin, basically to speed up in research, to speed up in patient interaction, and learn during the few years while actually investment are taking place internally. What is interesting is that for small companies, it gives the scale quickly. So if you have a smart solution tailored to the patient, and for pharma, it's really also with science into it, then you get the scale, you can get to real proof of concept very quickly. You give access to expertise that generally is expensive for startup, but is available in pharma and not always used, let's say at best or at full capacity. And then you get actually proof points or use case or results, whatever you call it, that proves actually the outcome impact that your solution gives. So benefit is very clear. And the other thing that is very important, and I can speak a little bit what was done with Dario, is that it's not a blueprint you keep repeating from one to the other, but there was a very good sit down between the teams and saying, what is a real win-win partnership? And I think the team took quite some time to get to the right formula, which may seem a little bit cumbersome and too long, but I think it's really needed, because now the two parts really see the win-win, and I think it takes a good momentum. Somebody was asking me what's the cons in a partnership. Maybe I'll mention two things. I mean, one is starting small and delivering results. From my experience until December, we had a lot of companies coming to us, Sanofi, promising the moon, and delivering nothing. Because of course the moon takes a bit of time to build a rocket and get there, and a lot of disappointing experience. So starting small, but delivering is very critical. The other advice I would give is, and it's the same actually for big pharma, is one partnership is good, but you generally need more than one partnership on your different facets. I mean, you may need only one with big pharma, but then others on your interaction with providers, on your software. I mean, Sanofi has done the same. If you look in the press, there was some let's say, communication there on the whole AI plan of the company. I mean, you need different partnership here. So yes, that's how I would develop it, and I hope it resonates for the two of you.
Yeah, it is. Well, so I'll share one practical example of what you're saying, and then I want to hear your perspective on partnership as well. So with our partnership with Sanofi, look, first of all, I would say that pairing an app with a pill is great. It is the least interesting use case in digital for digital's relationship with pharma, because you've got the infrastructure for research, for commercialization, for product co-development, for investment. I mean, there's big infrastructure plays to be made here. And for us, you know, and based, not just us, but essentially every digital health company, there would be no way for us to conduct the kind of research and bring to bear. You know, we've had 2 studies in the last month. One was a difference in difference, you know, matched, propensity matched, very large, thousands of patients kind of study that showed almost 10% reduction in all-cause utilization and an almost 25% reduction in hospitalization. Then we had another several thousand patient study that was a matched that compared Dario against motivated people with diabetes and found very dramatic reductions in HbA1c, over 2.3 for people at a baseline of 9 or more. There's just no way that digital health would be able to do, no digital health company can conduct these kinds of studies without the infrastructure. So for us, I think 2 takeaways. Number 1 is the ability to solve, as you said, the proof points that everybody's waiting for digital health. And we want to get there quickly, and the only way, I would argue, is through partnership. And then number 2 is thinking broader beyond the simple case of, you know, pairing a pill with an application. And that's just the pharma case. So there's many other opportunities to think broader for partnership. And I'm curious about how you're thinking about it with Elektra. I mean, how are you thinking about partnerships and their ability to scale what you're doing?
Yeah, absolutely. We started out working with consumers. Patients were the ones that were struggling, navigating symptoms. You know, for those who don't know, menopause can be a 10-year, sometimes 15-year transition. 80 to 85% of women report that it affects their quality of life, and these are the women that are the caregivers. They power our economy. So this is really a very important demographic that has been deeply overlooked. So that's where we started. As a startup, that makes sense. And we spoke with employers, health plans early on, and the feedback that we were getting is, we're trying to really wrap our arms around maternal health benefits, parental leave in some cases. This is only 4 years ago, and so I do think that this space has made great strides. I worked in behavioral health about 10 years ago. We heard something very similar, like, yeah, we get there's a problem, but like we're not totally sure of the ROI yet, the business case. So I try to keep that in mind. You know, you do need patience. It's, as you said, it takes time to build a rocket. But we have found, and I think part of our mission is to smash the menopause taboo. What that means is bringing this conversation, this topic into the light. The opportunity is massive. There are 50 million women navigating this time of life with, you know, who are deeply underserved. And so when it comes to partnership, that is the opportunity to scale. Bringing employers and health plans along for the ride has resulted in us being the first menopause-focused company in digital health to partner with a health plan that we're very proud of. That was Mass General Brigham Health Plan, so not an easy plan to crack, I would say. We doubled our contract within a week. We've quadrupled it within a year. We are being offered to members on their fully insured book. So they see the opportunity both to market themselves to their customer, employers, because employers care about this demographic, and because Elektra is helping them to engage this membership that is pretty unengaged and yet is at that rising risk level where it comes to their medical costs. So, and we have also partnered with Emblem Health. There are a whole host of others in pipeline, which I can't speak about, but we do see the opportunity to hit, you know, this escape velocity by partnering with enterprise scale organizations, because otherwise you are fundamentally just going to spend all of your money on Facebook ads trying to acquire consumers, and that is not the way that we want to be able to be accessible to the majority of people who have health insurance through their employers and would like to use it. Lastly, I'll just add that we are also going in network for Medicare and Medicaid, because access for those who have the least access to high quality healthcare is an important pillar for our mission.
And I have a question for you, Omar. Is generally companies tend to focus on just one disease,
right?
Just diabetes. I mean, you took an approach going a little bit broader, maybe more like putting yourself in the shoes of the patient. So tell us more about this.
Yeah, well, so I mean, I think people don't just have one chronic condition. I mean, they have multiple chronic conditions, and if you're a person seeking to navigate this, how many different user journeys are you going to have to participate in? How confusing is that going to be? And they'll never talk to each other. And yet, you have 70% of people with diabetes also have high blood pressure. Many of them have behavioral health, as you said. All these conditions overlap, and yet what we ask people to do is separate things. I describe it as akin to paving the cow path, where what we've done is we've said, okay, you have to drive to this parking lot to get your behavioral health, and you have to drive across town to get what we've done in the digital world is essentially replicate that broken way of doing this. So unless we can really not only technically and integrate the data, but we have to integrate at the clinical layer, so that, for example, with what we're doing, if you have diabetes and hypertension, you're going to get different recommendations about what you might try eating or how you might try exercising or other things compared to if you just had one or the other. So that clinical level of integration cannot be solved even if you share the data layer between multiple point solutions. And so at the end of the day, what we're finding is it's easier for the health plans, it's easier for the employers that are seeking to solve, and we're seeing, I've heard this recently, that we're seeing basically the largest increase in medical trend since the Reagan administration. So if we don't get a handle on these costs, and if you want to get a handle on costs, you got to treat the chronic conditions. And if you want to treat the chronic conditions with digital, you have to drive engagement. If you want to drive engagement, you have to make it easy for people and focus on, as you both said, what matters to people is generally far more important than what's the matter with people. And unless that's our North Star, we're gonna fail as an enterprise. And I think it's a bad idea to bet against technology, but we're gonna accelerate a lot faster if we can focus on those high value overlapping areas, comorbidities, pain points for the plans and for the employers, the things that tend to cost a lot, the things that are very behaviorally driven so that we can impact them. For example, for us, the litmus test is if you could change 25, 50, 100 things that a person did in a year, if you could do that with digital, what impact would you have on ER visits, on inpatient hospitalizations, on outpatient, on RX? So that's the way we're thinking about it. And I think I know I'm biased, but that's the only way to think about it, because you can't expect employers to buy 40 point solutions. It's just unsustainable. Yeah.
Totally. I couldn't agree more. And to give a concrete example, we have members that we're taking care of. They're going through their medical history, and they come to us because they have a burning, 5 minutes, they have a burning desire to take care of their symptoms. Oh. They cannot sleep. They have hot flashes, night sweats. They are experiencing, vaginal dryness, sometimes bleeding. These are pretty big issues that are drawing them to us because there is no real destination out there, and they are often overlooked. But in getting to know them in this personalized journey, we realize they have prediabetes. They have a family history that might predispose them to, other cardiometabolic issues. They are scoring on a PHQ-2 or a GAD-2 a level that suggests clinical intervention may be appropriate for anxiety and depression. So we can take them and then hand them over to, make a warm introduction because their employer already has a relationship with Dario. And that is so much the responsibility that we have to be able to share members rather than to say, we're going to build a wall around this member and their data and hold on to them. I think that is absolutely the wrong way to build. And I hope that the next generation of digital health will move much more in that direction.
I've heard you talk separately about how this group also is known to cost more.
Yes.
The group that you're going after is known to be. So it seems like there should be a huge opportunity to go after that.
I think, given your clinical focus, the fact that we didn't shine the light on the data in behavioral health and comorbid conditions until more recently, and that's when the business models emerged and the interest emerged. So until you look at the data, which we have been doing, we just did the first actuarial study of about 2.6 million lives, commercial lives, of women with an ICD-10 diagnosis of menopause that is very specific, not like the 30 symptoms that frankly all of us have some of at some point, but really specifically, and in that population we see 50% more costs across all areas, and we see increased prevalence and cost in specific areas like diabetes, hypertension. You're hearing these terms a lot because, you know, these are the chronic conditions facing many Americans in middle age. So yeah, I think there's a huge opportunity, but it is just the beginning because we're just starting to look at the data and analyze what's there.
You know, there is a topic I want to throw here with my also European hat is the countries in Europe have thought about, you know, a way to help digital health companies to get to market. And one example I advise anyone in the room to look at is DIGA in Germany, which is a little bit like what was done in biotech, you know, a special path to get funding and reimbursement for a period, and then after that you have to prove your outcome. But it sets a very clear set of conditions, you know, set up data that you need to get, and actually also educate the companies to generate the data and get to this level. You get into a market like Germany for 1 year, obviously you get the population, you get access to it, you become a digital therapeutics, which is a real contribution to the treatment and not just a drug plus a gadget you have on the side. And then after 1 year, obviously with the data, you get a lot more arguments, you know, to prove your case. The reason why I throw it here to the room is that some of you might want to go to Europe, but I would say even if you don't plan to go to Europe and you want to stay in North America, it's a good education to take a look at that and the conditions. Because I guess, you know, it would help talking to payers or talking to FDA to also help them, you know, figure out where they need to focus, because they are also trying to learn. And I don't know if it's also your experience, but trying to learn the path of, you know, how you get to you focus on the right criteria, but then get this solution in place that we all know we're going to need.
Yeah, I mean, I think that at the end of the day, there's a number of frameworks. This is a sensible one that accelerates innovation. I've looked at that specifically, and but I think that the payers and the employer, we used to think of employers as a little less savvy when it comes to analyzing the ROI. But under the kinds of medical cost trend pressures that we're under right now, where it's just really exploding in terms of how expensive these conditions are, there's no choice. I mean, the payers, the employers are demanding a level of evidence. Digital health is not yet providing it, with a few exceptions. It can only be provided through the kinds of studies that we're talking about. But when we get there, like, so for example, for us getting there in rigorous studies around cost and clinical indicators, we're seeing a massive acceleration in adoption, displacement of existing solutions. So I think that's the real inflection point. Solutions that pay for themselves in health are exceedingly rare. So if you happen upon one and you prove it, that's the fire that gets lit underneath this entity that at the conference we're trying to get our arms around. Yeah.
Very good. So look, for the audience, maybe now we'll come to the end of the slot, but would you have a call for action to share with the audience here that you want them to think about or come to you at the break?
Well, I started with it, so I'll end with it. Yeah. I hope everybody goes away and thinks a little bit about women's health not simply being defined as reproductive health. We all deserve to live in good health and high quality health for the rest of our years. And so much of that depends on what happens in our 40s and 50s. And so think about that for yourselves, your loved ones, but also, you know, as leaders, your teams and the people around you, because there is lots of work to be done here. And you know, really, I think exciting progress on the horizon. There's a real zeitgeist building, and I invite you to be a part of that.
Yeah, and I think I'm very excited about Elektra, and so I would want to echo that. But also, I think from our perspective, it's if you're an employer, if you're somebody out there looking to solve the cost trend, looking to solve these chronic conditions, really to drive for employees and their families, that the key issue is, will people actually use the solution? Will it be engaged? Does it have a consumerized DNA? So many companies have skipped to direct to consumer. I think ultimately that's not going to be a winning strategy in the long haul. So I would say for those that are looking to solve these multiple conditions, that's where we slot.
Yeah, and from my side, it's very clear that 5 years ago, digital health was a drug plus. Now, and that's why I left pharma to focus on these, it's getting closer to digital therapeutics, which is like the other leg of a successful health management. And my call for action is, take this route. Take this route, and for pharma, it's going to change a lot. For healthcare, it's going to change a lot, and I don't think it's far anymore. It's probably happening in just a few years.
All right. Great conversation. Thank you.
Thank you.
Thank you.